Okay, so disability benefits. Now, those of you who have some familiarity with the welfare benefit system will know that there are different categories of welfare benefits. Now, one category is one that is entitled, funnily enough for today, disability benefits. So what are they? So disability benefits are a range of benefits that are tax-free, so they don't class towards your income tax allowable allowance. They are non-means tested, so they are not based on any other household income or savings held, and they can be paid if you're in or out of work. Okay, now these are benefits that are subject to set eligibility criteria, so they have rules which you must meet to be able to be entitled to receive these payments. And they're paid to someone who has a need for help and support with their personal care, making sure that they are safe, and in some cases getting around. Okay, so they have a care component and they have a mobility component. So it can be really confusing to think around which benefits should I claim. So bearing in mind that you could be in full-time work and you could still claim a disability benefit. You know, so let's have a little look and see which ones there are. Now, there are quite a few disability benefits, and it's going to come down to where do you live. Okay, so if you live in England, Wales and Northern Ireland, if you were to make a new claim for a disability benefit and you were a child or a young person under 16, so as a parent, carer or guardian of a person under 16, then you would be supporting them to make a claim for Disability Living Allowance. So this is known as DLA. If that person that you are caring for, or you are going to make a claim yourself, because you can claim carer's allowance and a disability benefit together, and you're age 16 to state pension age, then you would be looking at making a claim for personal independence payment. So that's known as PIP. So these are new claims only. Now, if you live in Scotland and you have a child or young person under 16 who you're supporting, then the benefit to claim would be a child disability payment. 16 to state pension age claimants, that would be adult disability payment. And across all 4 nations, so England, Wales, Northern Ireland and Scotland, if it is a new claim for an adult over UK state pension age, which is currently 66, it's a claim for attendance allowance known as AA. Now, these are the claim rules currently. Now, previously in the past, you may have supported or you may have been in receipt of disability benefits. So, for example, Disability Living Allowance used to be a benefit that was claimed by anyone over 16. Okay, so that benefit may still be in payment for adults. That doesn't mean that they're not entitled to it anymore. It just means that actually for new claims, they will be claiming a different benefit now. Okay. So I'm going to start with children and young people first. Now, the eligibility rules for both Disability Living Allowance, so remember England, Wales and Northern Ireland would be DLA, and child disability payment for those in Scotland, overall, for the most part, they're identical. There are a couple of changes under the Scottish provision, so the child disability payment. So this is especially how terminally ill children are treated. There's a slightly different definition of when a child is treated as severely and visually impaired. And for some differences where someone has dialysis by both day and night. So generally, the entitlement rules are very broadly similar for the most part. But when you get to the nitty-gritty, there are some slight differences. So I'll put some further information there about those differences, because if you were to be making an application, that's when you need to be looking at those. Today, while we're just exploring, we're just going to stay with what's pretty broadly the same, just to give you an idea of potential entitlement for the person maybe you're caring for, or as we go into some of the adult-based benefits for yourself, if it's going to be applicable. So, for all new claims, For child disability payments and disability living allowance, they're only available to children and young people under the age of 16. Okay, so that's at the point of claim. The child or young person must need care, attention, or supervision because of a physical or mental disability or health condition that they have, but no formal diagnosis is required. Okay, so they don't need to have a statement of condition. If someone is living with ADHD, for example, they don't need to have that formal diagnosis or have that education certificate issued to them. No formal diagnosis is required, but they must have needed this care, attention, or supervision for at least 3 months and be likely to need this for a further 6 months. They must need substantially more care, attention, or supervision than another child or young person of the same age who does not have a disability or health condition. They must also have no immigration conditions attached to their stay in the UK, and they must meet the residence and present conditions. So those bottom two parts you'll see on every welfare benefit claim within the welfare benefit system for the UK. So immigration conditions are things like they must be able to have recourse to public funds. And a lot of people who maybe have come in on a visa might have a stamp like that in their ID card or passport that says that they have no entitlement to be able to claim public funds. And the residence and presence tests are very much around where you currently are when you're making the claim and where have you been in the 3 years prior to you making a claim? So where have you lived? Because the expectation is that you are resident of the country you're making the claim, or you are currently in that country and it's your intention to stay a resident of this country. Okay, so just to be mindful. And this is where a lot of people, so I'll use the example of a lot of UK nationals may have gone to live out in Spain. They've lived out in Spain for 20 years or so. As they are advancing in age, they are maybe deciding that they would like to come back to the UK to be nearer with family. But because they haven't lived in the UK for 2 out of the previous 3 years, because they've been residing in Spain, then they would have to show that they are intending to make the UK their home, among other things. So there is no automatic entitlement to a welfare benefit, even if you're a British citizen, if you have been living outside of the country. Okay, sorry, I digress. Now with disability living allowance and child disability payments, there are 2 components. So as known, there is that care component. That care component can be paid at a lower rate, a middle rate, or a higher rate. There is no lower age for claiming, so from birth. However, there is that 3-month qualifying period, don't forget. So you have to have a condition for 3 months and for it to be expected to last for 6 months. However, if a child or young person is terminally ill, there is no qualifying period. And we'll talk a little bit around the special rules that go alongside prognosis of terminal illness, or where there's a life-limiting aspect that could reasonably be expected around someone's health condition or disability. The current weekly rates, and so I'll put these on all of the slides, but just to give you a rough idea, for the care component, it's around £26.90 a week, the middle rate £68.10, the higher rate £101.75. Remember, that's tax-free. It isn't taken into account for any other welfare benefits as income, so it can really help supplement household incomes, and it can also link to higher amounts of other benefits being paid as well. So for that care component to be paid, someone will need to have a need for a lot of extra help with their personal care, supervision, or someone to watch over them, and that help must be substantially more than help needed by other children. So for example, if you have a 2-year-old who is very, very active, you need to supervise them because they are so active. you would need to be able to show that you are having to supervise them substantially more than another 2-year-old. And so that can be quite tricky to show. So you need to be really clear with the evidence that you're providing when you make these claims. We do have some further information about how to claim. There's been some other share and learn sessions on filling in forms, claiming benefits, challenging benefits, etc., that you might want to look a little bit further into after today's session. With the mobility component, this is only paid at a lower or higher rate. And in order to be able to qualify for this, you'll need to show that your child or young person is unable or virtually unable to walk, or needs substantially more guidance and supervision than a child or young person of the same age without a disability or health condition. So we're beginning to see a common theme here. So substantially, reasonably, you need to be able to show this. The lower rate mobility component can be paid to a child from the age of 3, from the child from the age of 5, and the higher rate is from the age of 3. So this allows for any developmental delays that somebody may be experiencing as they're growing, but the higher rate mobility component is the one that can allow you to access transport, so through the Motability Scheme, for example. The higher rate mobility is for those who are unable or virtually unable to walk, or where the exertion required would constitute a danger to their life or would lead to serious deterioration in their health. Now, children can also qualify if they have a severe visual impairment, are both deaf, or are classed as severely mentally impaired. And there's a lot of information about what does that actually mean when it comes to the mobility part of it. Because people obviously are looking to see how they can help, especially if their child or young person is struggling, maybe with public transport or difficulties with them being able to self move around, for example. So the mobility components are paid at the £26.90 for the lower rate, £71 for the higher rate. These are weekly rates, so it is very possible that your child or young person could get the higher rate of care, which was £101 something, plus the higher rate of mobility, which is another £71. So your household could benefit from a weekly bonus of around £175 if you had a successful claim. So the further information around the claiming process for both benefits. So with these particular benefits, you can either make an application online, or you can telephone, and then you can fill out a pen and paper form. There is no medical assessment for these benefits, so your child isn't going to be medically assessed by anyone. You will be asked to provide information from someone who knows the child well, so that could be their school or their nursery, or it could be that you have a diagnosis and a clinician or somebody who can support your particular claim. But the claiming process is quite straightforward for both of these benefits. So all of the disability benefits fall into 2 other categories. So we've got working age disability benefits, and then people who are not of working age. Now, working age is defined currently by whether you are eligible to claim your state retirement pension. So you've reached state retirement age. Now, some people choose to work past that, and that's absolutely fine, but you would then be looking at a benefit for someone who is not expected to work. So working age is currently 16 up until, I think it's 66 and a little teeny bit, because the state retirement age is on a current sliding scale up until the age of 67. I think it's due to get there in 2025. So it's currently 66 and a bit. So if you are in Scotland, then you would be looking at making a claim for adult disability payment. For England, Wales and Northern Ireland, it would be personal independence payment. So that's PIP. So the main difference between the two is how claims are made and assessed. So these have slightly different claiming and assessment processes. So again, there's some links there. The main difference pretty much is that if you make a claim for PIP, so England, Northern Ireland and Wales, then you are more likely than not to be called for a medical assessment, which will be carried out by an assessment provider near to you. Some claims are not medically assessed, but that's more of a rarity than a common occurrence. In Scotland, it's the other way on. It's more likely than not that you will not have to attend a medical assessment. They're called consultations in Scotland, a medical consultation. So it is just a case of where you make the claim and how that particular process follows for that nation. So the payment levels and criteria are exactly the same. Both benefits expect you to have met the disability condition for at least 13 weeks. So that's just over 3 months. And expect your problems to last for another 39 weeks. So that is 9 months-ish. Okay. And so this is where people who are maybe temporarily incapacitated, so for example, might be having a hip operation or have been in a car accident and have broken their leg, or is really struggling with chronic flare-up of pain and they're not able to work. They're not able to claim a disability benefit because they don't meet the past presence test, it's called actually. So the 13 weeks of having the condition already, and then for that expectation for it to last another 39 weeks. So they haven't had it for 3 months and it's not expected to last for a further 9 months. So this is where the criteria for disability benefits can be quite tricky for those of working age. But as a side note, if you weren't eligible for a disability benefit because of an accident you'd had or a flare-up of a condition that meant you were not able to work and so on, you would be looking at the out-of-work benefits or the sickness benefits rather than a disability benefit. So again, PIP or ADP, made up of those two components, the daily living component, the mobility component. Each component can be paid at a standard rate. So this is where your ability to carry out the daily living or mobility activities is limited by a physical or mental condition, or an enhanced rate. So that's where your ability to carry out activities is severely limited by physical or mental health conditions that you may be living with. Okay, so over 16 to claim, you must satisfy the daily living or mobility activity test. We've talked a little bit about the 3 months and 9 months. You need to actually be in the UK. You need to be a resident of the UK, Ireland, the Channel Islands or Isle of Man, not subject to immigration control. And for these benefits, you have to have been here for at least 2 years out of the previous 3 years. So that's 104 weeks out of the previous 156 weeks. Paid at different rates. So currently, if you get the daily living standard component at 68.10, goes up to 101.75 for enhanced. Mobility 26.90, enhanced £71. So they're the current rates. I'll put a link to the proposed rates from April. They haven't actually been signed off, but it looks as if they are going to go up. I think it's about 6.3% from April onwards compared to this year's current rates. So the current proposed rate schedule is on the GovUK website, and that's just showing you how much things are going to go up from. It's around about the 8th to the 11th of April when we start to see benefit increases. With these benefits, so the adult benefits, when I was talking about activities, okay, so you are assessed against a set of points that you can gain from your ability to relate to certain activities. And with the form filling sessions, we look at how these points work. But basically, there are 10 different activities that you are assessed against. And these are things like preparing food, taking nutrition, washing, bathing, monitoring your health condition, toileting, any incontinence needs you may have, any struggles with dressing, undressing, communicating, reading, understanding, engaging with others, being able to make budgeting decisions, for example. And if you score 8 points from those 10 activities, you would be awarded the standard rate. And if you score 12 points, then you would be awarded the enhanced rate. So it's a point-based system for both adult disability payment and personal independence payment. Okay, so for example, that was for the care part. For the mobility component, again, we've got 2 more activities that you're assessed on a point-based system. So these are the ones of planning and following journeys. And so this would include things like considering the barriers you face related to any mental, cognitive, or sensory abilities that you have. Environmental factors, such as being unable to cope with crowds or loud noises, are considered here. And then we've also got the practicalities of moving around. So activities such as your physical ability to be able to move without severe discomfort, such as breathlessness, pain, or fatigue here. Again, we've got that 8 points and 12 points situation. So if you score 8 points in either of those categories, then you would be awarded a standard rate. And if you were awarded 12 points, then you would be entitled to the enhanced rate. Okay, you are able to combine points totals from different categories, but you can only include the highest scoring point from a particular category. So you might meet the criteria for 2 or 3 points within a separate category, but you can only take the highest scoring and move it forward. Okay, so that was between 16 and 66. Attendance allowance, AA, this is for people over state retirement pension age. So this is a slightly different benefit. So with attendance allowance, somebody needs to meet the activity tests and they must have needed help and support, again, with their daily living, personal care, and or their mobility activities for at least 6 months. You can make a claim before the 6 months are up. However, you'll not receive a payment until the 6 months anniversary. Again, you need to be present. Again, you need to be habitually resident. And again, you have to have been in the UK for 2 years out of the last 3 years in order to be able to make a claim. With this one, it's paid at 2 rates. We've got a lower rate and a higher rate. Okay. You'll automatically be paid the higher rate if you meet one of the following criteria. So with attendance allowance, there were 2 main tests. We have a daytime test and we have a nighttime test. If someone needs help and support during the day, you will be paid the lower rate. If you need help and support during the night, you will be paid the lower rate. If you need help and support during the day and the night, you'll be paid the higher rate. If you are making a claim under the special rules because of terminal illness, you will automatically be paid the higher rate. Okay, so you'll notice with this one, we have no mobility component. What we have is 2 rates. We have a higher rate and a lower rate. But the kinds of things that we are considering when it comes to those 2 tests, build in an element of mobility within the household. So for the daytime test, for example, you need to show that you reasonably need help either with personal care. Reasonable frequent help is about 3 times a day or more. Someone to check on you continually, so frequently or regularly throughout the day to make sure that you're safe. So if you are caring or supporting someone who has that need for constant supervision to make sure that they're safe, maybe they are at a risk of wandering or maybe at a risk of hurting themselves, you can quite easily meet the 3 times or more support part of that. Nighttime test, you need to show that that person reasonably needs help with either of the following. And nighttime is classed as when your household settles down and goes to bed for the night. So when that person goes to bed, so be it 6 o'clock in the evening, 12 o'clock at night, so when that person goes to bed. Once they've gone to bed, do they need help with personal care at least twice a night for at least 20 minutes? Or do they need someone to check on them at least twice a night or once a night for at least 20 minutes? And so things like this can include if you need to get up through the night to support someone, maybe they've got some incontinence problems, you need to get them washed, bathed and changed, maybe you've got to change the beds, you've got to settle them. So this can quite easily happen once or twice a night, and it's going to take at least 20 minutes or more. So the nighttime test can quite easily be met as well. But if you need to be providing care through the day and through the night, then you will be looking at a higher rate. When it comes to personal care, just to clarify, because it can seem a little bit vague, supporting people getting in and out of chairs, bathing, washing, dressing, undressing, medications and treatments, getting in and out of bed, sleeping, communicating, eating and drinking, seeing. So if you need someone to see for you, very common if people are trying to look at labels or food expiry dates, or being able to manage the correspondence or the finances, for example. If people struggle with breathing and they need help using equipment, so you could have CPAP machines, or there could be oxygen involved there, using the toilet and walking. So this is walking inside for that particular one. And with supervision, this is when you need someone to check on you regularly to avoid a substantial danger to yourself due to disability or health condition. A good example of this is that you would need checks if someone has memory loss, they're in danger of falling, have poor awareness of potential dangers or serious behavioural problems, could lose consciousness or potentially have seizures. So there's quite a lot involved with this one. Claim process is really straightforward and simple. With this one, again, no formal diagnosis is needed. Okay. If you have evidence to support the claim, you'll be asked to provide that. This is very much about you completing a form or supporting the person to make the claim, because it's always the claimant that makes the claim. And you providing information to show what help and support that person needs. So as a caregiver, you might be writing a written statement as supporting evidence alongside the application form. You can phone up and get the form sent out to you. Again, include that supporting evidence. There is no medical assessment for attendance allowance. So just to reassure you, the person won't be asked to go for a medical assessment. And whenever you make an application, it's always worth just knowing that the application will start from the day you make that telephone call. So if it takes you 2 to 3 weeks to fill the form in and you send it back, any payment on successful award will be backdated to the date you made that telephone call. A couple of other things just to mention before I go through your questions. There are special rules that apply if someone is nearing their end of life. So this will allow them to get faster, easiest access to certain benefits. It takes away a lot of the waiting rules. Higher payments are automatically put into payment. There are no medical assessments, even for the benefits where medical assessments would apply. An adult or child or young person there who is nearing the end of life when they're likely to have less than 12 months to live. So if a person's prognosis is that they have less than 12 months to live, they can make a fast-tracked claim for the following disability benefits, but also for some other benefits like universal credit or employment and support allowance, so out of work benefits, income top-up benefits. A clinician, so a clinician could be a GP or a consultant or a specialty doctor, a hospice doctor, for example, is asked to complete a form to support that benefit claim, and then know that under the special rules, it will be fast-tracked through that. So the special rules apply to anyone who may be nearing their end of life due to age or illness, or is born with a condition that isn't expected for them to see life for 12 months or so. But there are no negative consequences. So say someone made a claim for benefits under special rules because it was not expected that they would be able to have life past 12 months. So, and they're actually here 2 years later. Okay, so there are no negative consequences to this. The benefit claim just continues on, and then it will be renewed after 3 years if that person is still with us after 3 years. Because people worry, they think, oh, if I make this claim, and what happens if it's not exact? There is some flexibility when it comes to this. And if you make a claim for a benefit and you are either refused for it, or you are not quite happy with the award level that you have been given, you can read more about asking for a decision for it to be looked at again on our website there. Generally, you must ask this process. So you must start the process as asking for someone to look at it again within 1 calendar month. There are some circumstances where you have longer, but no, always within 1 calendar month if you can. This process is known as asking for a mandatory reconsideration. But if you do have an award and you ask for it to be looked at again, just be mindful that the award will be looked at again. It could be increased, it could stay the same, or it may go down, or it could be lost altogether. So if you were thinking about challenging a benefit decision that is in place currently, then it's always worth taking advice. So talking to a welfare benefits advisor and also seeking advice on tactics and options moving forward. And that's a big part of the role that myself and my colleagues, we do a lot of, is getting people to think around the eligibility criteria for different levels. Because sometimes, you think you should be paid at a higher rate, but you don't actually meet that criteria for a higher rate award. This very last slide, this link slide just takes you to links to information around all of the benefits, special rules, challenging benefit decisions. If anybody would like any further information or has any advice that you think of after today's session, there's a link there to where you can find that information on the Carers UK website. You can also email the helpline where myself and my colleagues work, and that's advice@carersuk.org.